Includes a broad spectrum of chemicals and compounds in the air, and many of them are known to be damaging both to the lung tissue and also with exposure over time can increase the risk of disease. Some of them are also known to be carcinogens, so chemicals or compounds that can increase the risk of cancer. People with asthma and chronic obstructive pulmonary disease may often suffer increased symptoms during these periods of time. Things like coughing more, waking up at night short of breath, wheezing, and being just generally feeling more weak and tired. Many patients, when I ask them, tell me that the minute they wake up in the morning, they can tell it's a day with inversion. They don't even need to hear it on the news just because of the way they feel. What people with asthma and COPD can do when there's an inversion to try and minimize the risk to their health is to, number one, stay indoors and avoid breathing the air. And similar to that would be if they're going to exercise, and really for all of us, if we're going to exercise indoors rather than outdoors. When we exercise, we tend to breathe deeper and get more of the bad air into our lungs and can cause more damage. People with asthma and COPD who have inhalers may notice that they need to use their rescue inhaler more frequently, and in more severe cases they may require additional inhalers or even medications, and they should definitely contact their physician if they're feeling particularly bad. Additionally, people with heart disease and heart failure can also be affected, and certainly there's studies showing that people with heart failure have an increased risk of exacerbation, meaning that the heart failure, which is normally reasonably well controlled, can worsen, leading to increased risk of hospitalization and emergency room visit. And those patients as well should stay in contact with their doctor based on their symptoms and see if additional treatment is indicated.